complete lack thereof. Growing up in a small community in rural Alabama, they don't cover it.
Yeah.
They don't at all. Yeah.
Was self-taught, which has positive and negative and neutral sides to it, I think. And self-taught, it was exciting because it, I would reach out and look and read and find themes and meet with people, and it was right when I was kind of traveling and meeting new people, so.
And my brother is 16. Lord have mercy. Now she talks about sex every day to him because he's gonna get somebody pregnant on accident probably, and he's a wild hair. But like, I realized that it probably was like more not for them, but then like seeing my temperament and realizing that I didn't really need to because I was smart, and if they thought that my behavior, I didn't go anywhere. Came home from school every day, like I don't know where they think I'd be having sex anyway. But my brother, he's like every day we'll be in the car. She'll be like, now, this is how babies are made. One slip, one night, and it'll ruin your life. And he's like, I know this. I'm like, well, she's just make sure you know. So that was sort of my experience. And of course, at church, it was like, the worst thing you could ever do is be have sex. Like, you could die. Be damned in hell.
It's just basically shamed. It's something that happens when you get married.
Yeah.
And then other than that, you don't talk about it. You don't think about it. They even it was shamed.
Book or a prompt or something, and he had gotten AIDS. And my teacher is in 5th grade. His AIDS or HIV, and my teacher was like, "This is a disease. If you get a cut and your blood gets in somebody else's cut, and then your blood is in there, then that's how it's transmitted. Okay. There are other ways to transmit it." And me and this girl looked at each other from across the table and kind of giggled because my parents had taught me what it was, and I assume hers had too. And the teacher was just skirting around the way that conventionally we think that you would contract an STD.
Like, my mom never had a formal conversation, but she just handed me the book, and she was like, you'll enjoy this, you'll read this. And then in 5th grade, I was attending a Catholic school, a Catholic grade school, and we had the Life series, where it was a 10-chapter book, and it was supposed to be teaching people about progressing as an adult in life. But I remember clearly in the puberty section or in the sex ed section, you never saw the word vagina or vulva or anything. You just saw uterus and fallopian tubes. I think were the only anatomy terms that they used for girls. And the guys, they called it a penis once, but then the rest of the times they just said male genitalia.
Because I feel like sometimes boys get a lot more freedom to be sexual people, but they also have a lot more standards that are held for them from their parents, at least. And so I guess to explain that is like a girl being sexual, her parents might give her a talk one time, but then they'll leave that alone. And then her brother might also be a sexual person, but that brother will get tons and tons of reprimands and reminders not to get somebody pregnant or something like that.
As evidence in what you have just watched, sexual and reproductive health care is low on the pole of what educators believe should be taught and what they are allowed to teach. So why do we in fact shy away from SRH health and care and education? Honestly, I think we're scared. We've been scared by societal factors as well as religious factors, especially in Appalachia, where religion plays into a lot of people's lives, whether they realize it or not. According to a study done by Advocates for Youth, evaluations of comprehensive sex education programs show that these programs can help youth delay onset of sexual activity, reduce the frequency of sexual activity, reduce number of sexual partners, and increase condoms and contraceptive use. Importantly, the evidence shows youth who receive comprehensive sex education are not more likely to become sexually active, increase sexual activity, or experience negative sexual health outcomes. Effective programs exist for youth from a variety of racial, cultural, and social economic backgrounds. There's little, if any, evidence to show that flawed abstinence-only programs are effective, even at achieving abstinence among teens. The real kicker is that no abstinence-only program has yet been proven through rigorous evaluation to help youth delay sex for a significant period of time, help youth decrease their number of sex partners, or reduce STI or pregnancy rates among teens. Reproductive health is essential to every single body on this planet Earth. Don't want abortions? Give condoms with education on how to properly use them. Don't want people to have sex before they're ready? Give us comprehensive sexual health education. It is proven that after abstinence-only programs, the rates of teen pregnancy actually increase. Even if people decide to stay abstinent until marriage or even their whole lives, every one of us should receive the education we need to understand our bodies and other bodies. There is much more to sexual health education than sex. It encompasses a whole array of things from bodily autonomy to body anatomy to just education into how we work as people. Preventative measures cost a lot less than reactive measures, mentally, physically, emotionally, and in terms of monetary costs. Education starts with us, and education will change the world. Let's start by radically changing our communities.
And afraid, so don't break.